Hey everyone! Today, we are diving into a topic that's both fascinating and a bit concerning: the impact of AI on medical stereotypes. Specifically, we are asking whether new AI models reproduce gender and racial stereotypes in medicine, and the answer might surprise you. First things first, let's talk about why this matters. AI in healthcare is a big deal, and it's only going to get bigger. But with great power comes great responsibility, especially when it comes to bias. You see, if these AI models are generating content that reflects and reinforces existing stereotypes, it could have real-world consequences. Imagine a doctor relying on an AI to diagnose a patient, and the AI consistently misrepresents certain demographics in medical conditions. That's a recipe for potential harm. Now, let's get into the nitty-gritty. Researchers at Flinders University decided to put two next-generation reasoning large language models, O3 Mini and DeepSeek R1, to the test. They asked these models to describe fictional patients with common medical conditions, and the results were eye-opening. These models frequently reproduced gender and racial stereotypes, which is a huge red flag. It turns out that advancements in AI reasoning don't necessarily translate to better representational fairness. Joshua Docking, the lead researcher, highlights a critical point. AI has the potential to transform healthcare, but it also risks exacerbating health disparities if it perpetuates biases. The study generated 36,000 unique clinical vignettes, and the findings were striking. O3 Mini and DeepSeek R1 consistently misrepresented the distribution of gender and race in medical conditions, mirroring issues previously observed in GPT-4. In fact, these newer models showed even higher rates of misrepresentation, with 78% for race and 56% for gender for O3 Mini, and 89% for race and 67% for gender for DeepSeek R1. What's more, these models overrepresented black populations in stereotypically associated conditions like sarcoidosis, systemic lupus erythematosus, preeclampsia, and essential hypertension. The median misrepresentation was even higher for these models compared to GPT-4, which is a cause for concern. So, what's going on here? Well, it turns out that these models might be defaulting to generating prototypical cases rather than representative samples. Qualitative analysis revealed that DeepSeek R1 explicitly invoked disease demographic associations when selecting patient demographics, without referencing quantitative epidemiological data. This suggests that the models might be learning and reinforcing existing biases rather than breaking free from them. Now, here's the thing: this isn't just about AI models. It's about the broader implications of AI in healthcare. As Michael Sorick, the research lead author, points out, these models consistently overrepresent certain demographic groups, which risks reinforcing narrowed demographic assumptions in clinical contexts. This is a big deal because understanding disease prevalence across populations is crucial for diagnostic reasoning. In my opinion, this study highlights a critical challenge in the development and deployment of AI in healthcare. While these models have enhanced reasoning capabilities, they still exhibit racial and gender disease stereotyping in common medical conditions. It's a reminder that advancements in AI don't guarantee improvements in fairness and representation. So, what does this mean for the future of AI in healthcare? Well, it's clear that we need to be vigilant about potential biases and continuously monitor their impact. Awareness of these demographic defaults is essential for the safe integration of LLMs into clinical workflows. As Sorick says, awareness of these demographic defaults is essential for the safe integration of LLMs into clinical workflows, and continuous monitoring of potential biases should accompany their adoption. In conclusion, while AI has the potential to revolutionize healthcare, we must be cautious about its biases and ensure that it doesn't perpetuate harmful stereotypes. The future of AI in medicine depends on our ability to address these challenges head-on. Thanks for watching, and I hope this video has given you some food for thought on this important topic.